Menstrual irregularities. We're talking severe cramps, heavy flow, discomfort. A lot of ladies have severe low back pain during their menstrual cycle. Some get terrible headaches and so on. Is there a solution? Is there anything we can do to help? Well, actually, there is. First off, you have to make sure we rule out some of the other things, like uterine fibroids can cause some of those things. Endometriosis is another one. Polycystic ovarian disease can cause some of these things. So as long as we're not looking at those things and everything else has been ruled out and we're just like, I don't know why, but my menstrual cramps are really bad and the flow is really high. They don't happen on a regular basis. I skip a month and I have two in the same month. If that's the case, sometimes it's a neurologic issue. If it's not a hormonal issue, it could be neurologic. Now we have nerves that go from the brain down the spine to our various organs, including the reproductive organs. And if you look at this chart right here, here's the brain, spinal cord, and all the nerves that go to all the organs. And anatomically, we have dissected this and seen this actually in human cadavers. There are nerves that go from the sacral area to the reproductive organs as well as the bladder. And so a lot of times, if the angle of the sacrum, and I'll tell you what that is in a second, if the angle of the sacrum is in an abnormal position, too high or too low, the nerves to the reproductive organs, ovaries, uterus, can be affected, which can lead to the back pain, the cramps, and the heavy flow and the irregular cycles. So this is what a sacrum is. Sacrum is the tailbone that's right here. This angle, when we look at an x-ray from the side, we measure that angle. We want that angle to be somewhere between 36 and 42 degrees. Up to 45 degrees is okay. But if that angle is too high, which is what's most common in people with menstrual irregularities, means the tailbone tips too far forward. The tailbone sits too high and tips forward. That can cause some of that. A chiropractic adjustment where we actually reduce that angle, we adjust down to reduce that angle, tends to work phenomenally well. Initially, the adjustments need to be done more frequently, but then there comes a time where some of these ladies will just stop in the day before their cycle is supposed to start and we'll adjust that and they don't have any problems. And we see that on a regular basis. We just had a lady who was having extremely high flow. She gets anemic, pain is severe. Literally after the first couple adjustments, all the pain went away. Now her menstrual cycles cause no more pain and the flow is much more manageable. We're still working on timing and regularity. She still skipped a cycle last time. She went 55 days between cycles. We're still working on that. There's probably other issues there, but literally aligning the sacrum through chiropractic care has made a huge impact on her and a lot of our patients. If you are someone who's experiencing menstrual issues, definitely seek out a chiropractor. That doesn't mean stop doing what your medical doctor told you to do. It just means look at it from a different perspective also, because this could make all the difference. If this was helpful, subscribe, comment, share, and let us know what you think. We'll talk to you again soon.